Some people say that they smoke and it makes them more anxious. And some people say they smoke because they're anxious. And then there's another group that says it depends on the strain. So what is actually going on with weed and anxiety? Drug scientist perspective. Well, let's start with what we actually know. And what we actually know is that there is a strong correlation between cannabis use and anxiety. So what we see is that people who are more likely to have anxiety disorders also are more likely to use weed and to report cannabis use disorder. So where it actually becomes like an addiction. The why is slightly more complicated. So there's the easy answer, which is that weed causes anxiety disorder. But there's not actually that much justification for this one. The things that make us scientists believe that it's not necessarily causal is a couple of things. First, it's not actually that strong of an association. So if you saw that weed actually caused anxiety disorders, you'd see a lot more anxiety disorders. And you'd see anxiety disorders distinctly rise when weed rates were rising too. And we don't see that. So that lack of a big effect and that lack of like when one thing increases, we should see that other thing increasing too. Yeah, that suggests that it might not be causal. So what are the other reasons behind this anxiety and weed link? Well, there's a couple of main ones. There's this idea that there's a common factor between weed and anxiety. So maybe it's not that weed is causing anxiety or it's not that anxiety is causing weed use, but there's some third variable there, some confound that is causing both of them at the same time. So maybe it's like you had trauma in your childhood and that made you more likely to use drugs and also more likely to have anxiety. And yeah, that's probably at least partially true. We do know that the environment does influence things like substance use and does influence the development of psychiatric disorders. But is that causing this entire relationship? Probably not. So the leading theory right now is a self-medication hypothesis, and that's the idea that people are self-medicating with weed to treat their anxiety disorders. What we see is that, yeah, a lot of people say that they started having anxiety before starting to smoke weed, and so they were using weed to treat their anxiety disorders. That is a relatively valid hypothesis. The problem is, weed is terrible at treating anxiety. And let me go into the specifics of this here. So first, when I say weed, I mean that THC is specifically terrible at treating anxiety. So there have been no human studies that show that THC decreases anxiety. Even at low doses, which we used to think it might decrease anxiety, yeah, no, we don't think that anymore. In fact, we see that there is a very strong dose-dependent effect of THC on anxiety. And it is an anxiogenic effect, which is a fancy scientific term to mean that when you use higher and higher doses of THC, you are more likely to feel anxious. And this makes sense from a physiological perspective because anxiety in a lot of cases, like I'm a person who has anxiety, I feel that in my body. And what we see is that THC substantially increases heart rate. Like that's one of the most common effects of it. So if your heart rate starts increasing, if your heart starts racing, you feel that as anxiety and you're going to feel more anxious. It's the same thing as I'm more of a yoga person. So when I do hardcore cardio, I'm like, oh man, my heart feels bad. Maybe I'm anxious. No, it's not anxiety. It's just cardio. So if weed is increasing your heart rate, which it does, it is likely to then increase the feelings of anxiety in people. And they found that this was true for things like both vaping and smoking. And they found that there is a sex difference here too. So women are more likely to feel the anxiety than men are. And that is specifically for things like edibles as well as vaping and not for things like IV use. But who is using THC IV? Like, why are you doing these studies? Ain't nobody using THC IV. Sounds like another good band name though, THC IV. Now, this study also found blunted anxiogenic effects if they were chronic users, which so many good puns there. But in general, what they found is that if you were a chronic user, you were less likely to feel those anxiety effects. Sorry for the dog wailing in the background. I have a new foster. And getting too high of a dose is actually kind of an easy thing to do, especially recently when like we have things like concentrates, which have a genuinely absurd percentage of THC in them. And edibles, where once you take them, you're going to feel the effects. So if you took too high of a dose, well, good luck. Okay, so that's THC, but now you're probably asking, what about CBD? Well, there have been all sorts of early suggestions that CBD might decrease anxiety, and yeah, we don't really see that that's true either. Now, this might be slightly different depending if you're looking at it like a one-time only thing, like you take CBD and then you do something, versus you are using CBD like long-term to treat anxiety. There might be something there with like mild anxiety if you're using CBD chronically, but we don't have good evidence on that either. Now, CBD, in terms of just like taking a CBD gummy and then going to do a public speech, yeah, also not great. Even less great than the anxiety disorders, actually. So there have been a variety of studies where they had people take CBD before giving a public speaking event or before taking a test in which they had a lot of anxiety. And also before they did a VR study where they had them fake going on the London Underground trains. Why? What is the point there? Are those extremely anxiety inducing? Like, I know that like trying to figure out where your stop is terrifying for me as somebody with anxiety, but like that as a task seems a little bit weird. But found that in any of those cases, even in the London Underground side, CBD did not work. Now I know what you're going to say. You're going to say the entourage effect, because whenever I talk about weed, the first thing that somebody says is the entourage effect. And yes, there is actually an entourage effect here. So we see that the combination of THC and CBD seems to do different things. So THC increases your anxiety. CBD doesn't seem to really do much to anxiety, but if you combine them together, so if you have a strain that has relatively high CBD levels with THC, that seems to blunt some of the anxiety increases that you get with THC. So THC increases it, CBD brings it back down again. So like, what are all of these effects saying together? Basically, that THC by itself might increase anxiety, especially if you're using higher doses. This might be more prevalent in women than men, although it does seem to depend on which method you're using. And CBD does seem to decrease the effects of THC, but doesn't do much by itself. So what do you do if you're somebody who's like, yeah, but I like to use and I also have anxiety? Well, first, like, try to just use lower doses. Also, you can always do things that decrease the potential for getting too high of a dose. So don't use concentrates, or maybe don't use edibles. So use something like flour where you can actually titrate more. And what I mean by titrate is to increase or decrease your dose until you get to kind of like the exact stage of things that you want. So maybe it's too high of a dose for you, and that makes you feel anxiety. So you decrease the dose for yourself. Remember, we're all very different in terms of how we feel the effects of a drug. So a dose that might be great for somebody else might not be good for you. So strains that are higher in CBD might potentially be better. We don't know anything about terpenes. Don't ask about terpenes. We've got no information about them as of right now. But in general, higher CBD and lower THC might be better for somebody who has anxiety, especially for women who might seem to be more sensitive to those types of effects. So what's going on with weed and anxiety? Well, all sorts of things. So it seems like people are self-medicating for their anxiety with THC, according to our best hypothesis. But we also see that that is a terrible idea because THC seems to actually be increasing anxiety. But now you know, so now you can figure out how to navigate these issues if they come up and know what to tell somebody when they're asking that question next.